Arguably, the most critical piece of the puzzle of hippotherapy is the horse. Horses move, and because they do, they cause patients who are on them to move. This is one of the basic reasons that horses are invaluable partners in therapy. Therefore, the horse's movement must be trained, precise, rhythmical, symmetrical, straight, and supple to facilitate responses in the patient. Without the appropriate equine movement, therapy will not be effective for meeting treatment goals. One of the qualities critical for the ideal horse is good conformation. Conformation means that the horse has good alignment of the spine, legs, and neck. The horse must have adequate musculature, yet be flexible and fit. Another quality is the horse's ability to move symmetrically and rhythmically. The final inherent quality is a temperament that is willing, tolerant, and adaptable to the requirement of the job. From head to tail, the horse should be well put together, giving an overall picture of balance and good health. How the horse is trained and handled can have a tremendous effect on movement. The walk, a 4-beat gait, is the most commonly used gait during the treatment sessions because it is consistent and the most adaptable of the gaits. Trotting is a faster 2-beat gait. This movement is occasionally used to increase the patient's proprioceptive input, arousal, and awareness. It is imperative to create the precise horse movement needed to facilitate successful treatment and meet therapy goals. Horse training and care. Initial and ongoing training is vital for a horse utilized in hippotherapy. Appropriate use of lunging and long lining develops a fit, well-conditioned horse with a strong back and steady symmetrical movement. Training also prepares the horse to respond well to handling in order to adjust to the needs of the patient at the therapist's direction. Any horse used in the treatment environment should be accepting of all equipment, props, and/or toys that may be used in the therapy session. Like people, horses react in different and unique ways to stimuli, so each horse must be trained to provide effective movements and maintain desired behaviors. Because horses are living beings that need care, it is important to pay attention to their health, rest, feed, exercise, equipment maintenance, and fit for their health and well-being. Regular riding and training is imperative to keep them fit and mentally stimulated. Turnout is important for the horse's mental well-being, and feed should be tailored to the horse's body weight, size, and individual needs. Regular veterinary care and farrier service keeps a horse sound and healthy. Equipment needs to be clean, repaired, and in good working condition. Therapy team.
Go that way.
The patient or client with disability-seeking therapy services must be evaluated and deemed appropriate to have this treatment strategy incorporated within their plan of care. Safety and the risk-benefit ratio regarding precautions and contraindications must be considered. Family support and compliance is imperative for the success of achieving treatment goals. The therapist is a licensed healthcare professional in the disciplines of PT, OT, SLP, and their state credentialed assistants, with further education on equine movement and treatment principles of hippotherapy. In collaboration with the patient, the therapist evaluates the patient, identifies functional goals, considers precautions and contraindications for using the horse in treatment, and develops a plan of care, including discharge plan. The therapist may provide hands-on facilitation and will direct the horse handler and sidewalkers as needed to create an effective treatment session. The therapist completes family education, develops home programs, documents and bills for therapy, just as they would in any clinical setting. Sidewalkers are individuals who assist during the treatment session. Sidewalkers are trained to keep a client safe and to perform emergency dismounts if a medical emergency or accident occurs. Sidewalkers interact with clients as directed by the therapist. Sometimes they provide assistance to help a client with alignment and positioning on the horse. With some patients, they may engage, play games, socialize, and motivate. The horse handler is responsible for grooming, preparation, selection in consultation with the therapist, and fit of appropriate tack. Tack is the equipment secured to the horse for the treatment session and may include bridles, halters, pads, and a surcingle. A surcingle is a belt that holds a pad on the horse's back. The surcingle may be flat or have handles. It can also be used to attach other therapy equipment needed during the session. The horse handler also prepares and warms up the equine for the treatment session. The horse handler is trained to produce correct and varied equine movement as specified by the therapist. The horse handler must be in tune with everything that is happening during treatment in order to respond to the therapist's requests. In an emergency, the horse handler is responsible for the horse. The horse handler should be knowledgeable in horse behavior and management and skilled to produce desired equine movement patterns to ensure the best therapeutic outcomes. The veterinarian specializing in equine health should provide regular well horse checkups and vaccinations. The vet should be on call in case of injury or illness. The farrier cares for horses' feet by trimming the hooves and setting shoes as needed to prevent lameness. By caring for the horse's hooves, the farrier helps to provide the best movement and long-term health of the horse. Depending on the size of the practice, there may be additional support staff, similar to those in other private practices. A role unique to this type of practice may be an equine manager, who is responsible for acquisition, training, maintenance, and retirement of horses. The equine manager is also usually responsible for the training and supervision of horse handlers. Many facilities also offer adaptive riding and share facilities and horses with therapists. Certified riding instructors can partner with a therapist who is not as experienced with horses to select appropriate horses for specific clients and to coach the therapist with horse-related movement and skills. Some accrediting agencies may require certified personnel, like certified riding instructors, to be present during a therapy session to meet liability insurance requirements.